Welcome everyone. Please excuse my lighting. My power should be back on any moment, but all you need is the presentation and my voice. So today's topic will be on boundaries. Here we've got what we'll be discussing throughout the presentation. So what are personal boundaries? Where do they come from? Why are they important? When are they necessary? How to set healthy boundaries, which will be the main part, and looking at positive relationships as well as summary and references at the end. So if we go from, sorry, there's an echo. Okay. I don't know if there's someone that's not muted. Please can I ask that everyone mutes their Zoom? Thank you very much. Okay, first and foremost, let's start with identifying what are personal boundaries. And I've put just a short explanation there, and it's the limits and rules that we set for ourselves within a relationship. These relationships include family, friends, workspace, acquaintances, so pretty much anyone that you may come into contact with. In addition, I'd like to note that boundaries can be both internal, which is within oneself, as well as external between one or more other people. Both are based off of a person's core values, beliefs, and moral standing. Next here, we've got the different types of boundaries. Starting on the far right-hand side with the spectrum of rigid boundaries. So as you can see, boundaries are not just black and white, they are a spectrum, but it is healthy versus unhealthy. And if we look at the rigid boundaries, so a person with rigid boundaries always keeps their distance from others, whether it's emotionally, physically, or otherwise. Very rigid, not open to change, not open to compromise, my way or the highway kind of mentality. And then the other two unhealthy boundaries are your loose or porous, as well as limited or non-existent. Now, a person with porous boundaries, they are someone that tend to over-involve themselves, overextend themselves, kind of be a walkover. Sorry, Luto, can I just ask you to please mute Cabello? Thank you very much. All right. And then we've got the healthy boundaries, which is the ideal. That's what we aim to achieve for ourselves. And a person with healthy boundaries can appropriately share and communicate personal information, wants and needs, willing to compromise, has a firm stance on their own values, moral standing, and opinions, and doesn't belittle anyone else's on the other side of things. Luto, anything you want to add on to the different types of boundaries?
No, I think you've highlighted all the significant aspects, and I think as we go further on, we'll sort of understand using examples sometimes of what are unhealthy boundaries and healthy boundaries and everything in between.
Definitely. Cool. Then this is just an overview of the different types of boundaries. So now the previous one was the traits, and now this is the different types. Not all of these may be appropriate to you as individuals. However, they are definitely noteworthy for different aspects of life, not just associated with your addict loved ones. You know, if you're looking at something like your material, might have associations with the addicted loved ones, but also yourselves. Are you overgiving? Are you overlending? Are you stretching yourself thin from a material perspective? Mental one is quite a big one in my value in terms of your thoughts and opinions, where you may be made to feel belittled, I like to look at that as someone with porous boundaries may be prone to being gaslit. Gaslighting, for all of those that don't know that term, is essentially being essentially being convinced of something that is true that you know to be true. So I'm going to use myself and Luto, for example, is I know factually that the sky is blue. However, Luto uses her powers of persuasion to convince me otherwise, that no, in fact, the sky has never been blue. It has always been brown, despite all evidence pointing to what I know to be true. And this can happen in your everyday lives of maybe a loved one has stolen from you, and this is kind of bearing a little bit into the material boundaries, and you know for a fact that you had a certain amount of money in a specific place. However, your addicted loved one or any person you may know tries to convince you otherwise for their own agenda. And then spiritual boundaries, that's, beliefs, topics of discussions, sense of belonging, connectiveness. I like to look at this one in a sense of everyone having their own spiritual beliefs or religious backgrounds, and someone with the very rigid boundaries in this essence could be quite verbally abusive in their telling of their own beliefs. And one with porous boundaries will just kind of accept whatever the person is saying. And then someone with healthy boundaries, very respectfully, that is your opinion, that is your belief. My belief is different to that. However, I welcome the conversation of discussing different beliefs and connectiveness and spirituality. So the rigid, the healthy, as well as the porous boundaries can filter into different aspects. Sexual boundaries, also a huge one in terms of sexual abuse of power, and that one is one that obviously we encourage that it's discussed at a very young age, so that one does not fall into the trap of sexual abuse or anything like that. Okay, now I want to move on. Right, to where do these boundaries come from? Where does this notion of why do I need to have boundaries, why are they important? So as I mentioned earlier, one's core values, beliefs, and moral standing play a huge role in boundaries. Generally speaking, we are raised to know right from wrong and how to identify that. As a child at home or at school, we are taught that our bodies are our own and a violation should be reported. And I think it goes to say for the other aspects of boundaries, in terms of if you're maybe not someone that likes to be hugged, or you believe something that's different to other people and that you should be respected in that light. Religion, culture, spirituality mirror teachings of morality and self. And I think that's a very important note to make there. And in addition, time and various life stages are a contributing factor to where these boundaries come from. My experiences differ from Luto's experiences, so my view of what I value, what I think is important, will differ from hers. There may be some overlap, as we may share some relation or some common standings in life. But generally, those are the main parts of where do these ideas and notions of boundaries come from. Okay, Luto, before we move on, anything from your side?
I guess I just want to echo perhaps the past two slides that we've touched on, that a lot of perhaps how our the types of boundaries that we have, and perhaps whether it's unhealthy or healthy boundaries, come from our values, our morals, sometimes even our personality. And just because you have an unhealthy boundary on one doesn't mean that you don't have an unhealthy boundary on. So it's also quite variation. For instance, just to cement what I'm trying to say is that perhaps your physical boundary might be a healthy one. However, your material boundary might be one that is quite healthy. So you can have variations even with the types of boundaries on whether it's unhealthy or not, or even sometimes in between. So it's not just one dimensional, it's quite multifaceted at the same time, but it's also about understanding who you are and what your basically your standards and what your limits are.
And I think that's a valid point. I'm going to head back to the types of boundaries slide, because as you were speaking, I made a note that you may not have the same boundaries for everyone that you come across. Perhaps with a stranger, you may have a little bit more rigid boundaries versus with family or friends, you've got a lot more porous boundaries, and then colleagues have healthy boundaries. But this discussion is as a way to be congruent as an individual, so that you're not multiple personalities in this space, that you're the same person across the board, that even with a stranger you are able to be respectful and accommodating and open and honest, and same with family, that you don't let them take advantage, or you allow them space to also share their concerns, their needs with you. All right. So now heading on to why are they important? So boundaries allow us to develop a strong sense of self, and this will allow one to not let people take advantage, and increase one's self-esteem. It allows us to appropriately and respectfully help others in an empathetic manner, which is if you truly want to help someone, that you help them, as well as not be consumed or become distant. And that's, the apathy part is where you're distant and disconnected. And then the sympathy part is where you are overly consumed, overly invested. So the ideal sweet spot is to get to that empathy point where you're able to understand their perspective and engage with them from that, but without piling on your own things or just not being engaged at all. Another reason why boundaries are important is to lessen the burden of care on yourself, as you won't always be bothered or worried by your family or partner or loved ones or colleagues, as much as we are a people, and people have that sense of connectedness, that sense of belonging, but you still need to make sure that you're taking care of yourself. And that's essentially what boundaries are, those limits of what's okay for me, what's not okay for me. It allows you to lessen the burden of worry, so you're not consumed by the other person, the other people, the other things, and that you know that your space is still respected, and your space is still taken care of. That also provides you with an opportunity to truly and wholly take responsibility for your actions and self, and the values and the beliefs that are your own. When we look at something like taking responsibility, is life's gonna life. People are going to act how other people want to act. We cannot control people, places, and things, but we are able to take responsibility for ourselves. We are able to take responsibility for our actions, and having those healthy boundaries where we know what our limits are, we know what our values are, and we're able to communicate that effectively. Should things go awry, we are able to take responsibility for our part to play in however things may have turned out. Next, we've got healthier relationships, healthier interpersonal relationships based on of mutual respect and understanding. So again, can't control people, places, or things, but if you know that for yourself, you are firm and fair within your beliefs, within your values, within your morals, then other aspects will bother you less and bring you down less, because you are able to still respect yourself while still be accommodating, um, and fair to those around you. And then it can be difficult in the space of addiction, and it can veer into more of an enabling component than a setting up healthy side of things. And it's something that we encourage to set those boundaries of and consequences. With healthier interpersonal relationships, you're able to stand by the consequences that you set out for your addicted loved ones or whomever you have around you that you may need to set boundaries with. And then lastly, to help us establish our own identity and a clear separation and difference between oneself and others. And this extends to feelings that one might have that are separate from another person. And that again ties back into that sense of self that I mentioned at the beginning, as well as empathy versus apathy and sympathy. Okay. Now, when are these boundaries necessary? This slide here with the list is just a long-winded way of saying everywhere, anywhere and everywhere. Home within the context of family and friends, school, maybe you've got some family and friends there as well, but also school, associates, different staffing members in school, same with work, your colleagues, your boss, your friends that might also be at work, other staff that's not maybe your immediate colleagues, shops, this when a stranger is standing too close to you, awkwardly close to you in a queue or something like that, bathroom spaces, airports, and anywhere really. This list could be much, much longer, but I don't think that the PowerPoint presentation graph that I'm using allows for more, but yeah, so we just cut it off right there. Right. Now on to how do we set healthy boundaries? It's all fine and dandy that we're able to identify, okay, I'm a person that has more healthy boundaries. I'm a person that has porous boundaries. I'm a person that has rigid boundaries. Or these are the different types of boundaries that are relevant in my life. It's great, fine and dandy to have all of that set up in mind. But now, how do we set these healthy boundaries? How do we make sure that we don't lose our sense of self? How do we make sure that we're empathetic and not apathetic and sympathetic? How do we make sure that I am taking care of myself, that I'm lessening the burden of care on my own emotions, my own mental state, my own spirituality, and my own physical well-being? And you know, life is full of wonder and tragedy. And in all this chaos, there's different ways to achieve goals of setting these healthy boundaries. But the graph that I've put before us is just a nice, simple way of wording it or just showing it how it works systematically. So as you can see, the first thing that needs to be done is identifying what are your boundaries. Okay. So I'm going to use physical boundaries because I think that one's the easiest. What are my physical boundaries? When I meet a stranger, do I want to hug or do I prefer to shake hands or neither? Okay, that's something that I put forward. In terms of material, how much money am I willing to lend to someone should they be in need? Or is lending money not something that I'm interested in doing at all? Sexual boundaries. What are some of the things that I'm comfortable with sexually and what are the things that I'm not comfortable with sexually? So it's kind of going through each of the different boundaries listed before and identifying for yourself as an individual, what are your limits? What are you okay with? What are you not okay with? Okay. Once you've identified that, then we need to establish a consequence. Now, when we're establishing a consequence, it's in essence, should one of my boundaries be violated in any shape or form, what will the action be that follows? What consequence would I put in place? And this is dependent on you as an individual, it's dependent on the context and other factors. But the main thing about establishing the consequence is, what are you comfortable with setting? If if you're using myself and Luto as an example in this case, is Luto and I have just met for the first time. I am someone that does not like to hug people, but I'm comfortable with a fist bump, whereas Luto just hugs everyone and anyone that comes into play. So I've established I do not like to be hugged. When I meet new people, I will give them a fist bump. Luto unknowingly gives me a ginormous, wonderful hug with all her oomph, and I am uncomfortable. That is the point where I'm like, cool, she has violated a boundary that, number one, she did not know of, but number two, something needs to come from that. So that is now where I say, okay, if someone hugs me instead of giving me a fist bump, then I will choose to not interact with them altogether. That's maybe the boundary that I'm setting. However, when you are establishing a consequence, it needs to be realistic to the space that you are at. If it's something like myself and Luto, we work together. So me saying that I will never interact with Luto is completely unrealistic, as we sit 2 chairs away from each other and we have patients that we see together. We have groups and sessions that we do together. So that is impossible to happen. So I need to pick something that's a little bit more realistic. Sorry, Luto, do you mind helping me there with the mute? Thank you. Okay, so now that I'm being a little bit more realistic about the boundaries that I'm setting, for me is that in future, should Luto hug me again, I will actually take a step back when I speak with her. That way I'm still maintaining my boundary as well as interacting with her, because I'm in an impossible situation where I can't run away from her. Not that I'd want to. Then we move on to the third part of setting the boundaries, which is, how do we communicate these boundaries? Some situations are more and some are less awkward and uncomfortable than others. But the main point is to be respectful and be direct. Using your morals, your values, and your experience, it's a matter of assertive communication. And there's a magnitude of ways that this can be done, but one of the ways that my colleague always brings up is, you need to set a boundary in 8 words or less. So in this space that I've just used the example of myself and Luto, it's where I am assertive in my communication, I am firm and I'm direct. Luto, I do not like to be hugged. Should you hug me again, I will have to keep my distance from you. Okay. That is showing her that this is where I stand. I am not a person that likes to be hugged. And should she break that boundary or violate that boundary, this will be the consequence that comes through. Okay. And then the last point is the follow through. Now, the follow through is the main reason why the establishing of your consequence is so important. The type of consequence that you put forth needs to be followed through. Otherwise, this whole system falls flat on its face. If you put up a consequence that you are not able to fall through, the person that you are identifying this boundary with is going to take you for a ride, because now you are not acting with integrity, because you're not doing what you say, and so you've got no leg to stand on in this space. And as much as I wish this was easier, I really do, but it's not. This is very individualized, and as families and people with addicted family members and loved ones, your boundaries may have been trampled on tenfold. However, when your loved ones are able to be in treatment or yourselves are able to be in treatment, a few things happen. Those that are outside of treatment, they get a space to regroup, recalibrate, relook at their sense of self, get the support that they need, and start thinking about these boundaries so that when the loved one, the addicted loved one, is out of treatment or back within your space, you're able to start afresh, you're able to really have thought about where you want to be, how you want things to be, and be open and honest in that sense. This topic is also covered in treatment, so your loved ones will also be doing the same thing from their side, because no one is perfect. We cannot control people, places, and things. When we look at taking responsibility, I am responsible for my own actions. Luta is responsible for her own actions, and we need to be open and honest about where we're going in terms of our personal relationship in that way. So that's why, when you put the follow through, if you say, if you do that one more time, I'm going to send you to jail or I'm going to get you arrested, then you've got to do that. You've got to stand by what you've said. And that brings us back to establishing realistic consequences for when your boundaries are taken advantage of or violated. Luta, before we move on, I know I've just been talking and talking and talking. Is there anything from your side?
Nothing significant to add, but just to sort of echo some of what you're saying in terms of, I always look at it in terms of where do my stuff start and stop, and where does the other person's stuff start and stop? And recognizing and identifying that uncomfortability when my boundary has been violated so that I'm able to communicate it and communicate it in the sense that someone, and be clear and direct in terms of, you have violated my boundary, and the follow through is very, very important, because one can say that you sort of teach people how to treat you as well. So communicating your boundaries is very, very important.
And also, establishing your sense of self is very important, so that you are able to communicate your boundary. Because if I don't know where my limits are, if I have no sense of where do I start and where does someone else begin, then this whole system falls flat on its face, because you won't be able to communicate what you don't know or what you're not able to identify. Okay, so now here's looking at positive relationships. Now, when it comes to healthy boundaries, they make way for positive relationships. And on the other hand, it could end up in resentment or loss of self-worth, self-esteem, and codependency. Hence the arrows facing different directions. Excuse me, oh, I'm so sorry. So this concept of codependency was introduced in the 1940s in association with a pattern of behaviors and patterns of behaviors that are identified in families of alcoholics and later addicts. So according to research done in 2018, the research review noted patterns of codependent behavior in generally four main themes. There is the self-sacrificing, a tendency to focus on others, a need for control, which may fuel conflict, and difficulty recognizing and expressing emotions. Just to talk a little bit around the need for control and in codependency, there's a tendency that I've noticed of families with addicted loved ones. In order to try, protect your loved one, to protect them, keep them safe, make sure that they do recovery the way you want them to do recovery, that's where sense of that need for control starts to play in, where loved ones will dictate how the recovery is followed and how the different components of recovery are interacted with, how often the addicted loved one must contact their sponsor, how many meetings they should go to, which meetings they should go to, in requesting that the addicted loved one's step work be shared with the family member, all of those things, which goes into that sense of control and codependency. You think that you're helping, but you're not. You're trying to control the outcome. You're trying to control people, places, and things, and in essence, start becoming unmanageable within yourself, um, where you're now losing, now you've got gained more burden by always thinking, where is this person? What are they doing? Have they done what I've told them to do? Let me message them. Let me call them. You get taken out of your own world, you're out of your own space to focus on someone else's recovery. Not to say that you shouldn't be supportive, you shouldn't be engaged, but it's a space of letting go so that the other person can flourish. Um, and the self-sacrificing of I'm only trying to help, I always do this for you, I always do that for you, I am the air you breathe. That also within codependency is unhealthy for yourself as well as your loved one, because then your loved one doesn't learn the consequences of their action if they're actions are always being fixed, or they're always being saved, or they're always being taken out of a pickle. And again, this is not an easy thing that I'm putting forward to you. I'm not saying you're going to sleep, wake up, and have all the answers and be perfect and know everything. It takes practice, takes time, and experience, and you got to start somewhere. You got to start somewhere. So just a little bit more. The next few slides are just different visual representation of codependency as illustrated by Gracia Lam. They just represent common codependency roles. So I'm just going to go on to that. Before I do, Luta, anything from you?
Perhaps also just to further echo what you're saying, because everything that you're saying is really quite significant. Just to revert back to my previous comment in terms of perhaps an illustration in terms of identifying where my stuff starts and ends, and where the other person's stuff starts and ends. So when now we have blurred boundaries, there's a level of enmeshment that happens sometimes, and that's where sometimes codependency comes in. Where now if I see you as I see myself, there's a level of I feel entitled, to have that controlling streak. Or perhaps I feel a set of responsibility that I should take on your stuff, which is very unfair, not towards you, but also towards myself as well. And that's where sometimes people pleasing comes in as well.
Yes.
So with a lot of the unclear or enmeshed sense of boundaries or blurred boundaries, there's a lot of codependency that you have to identify in terms of what is my sense of self and what are my boundaries and what's the other person's stuff as well. So not to take on, but also not to feel entitled to the other person's stuff as well. Because a huge part with addiction is sometimes the enabling as well, with the guilt and the shame. And I think we do have a family support group with regards to guilt and shame, where that has a huge aspect that plays. There's a huge aspect that plays in there, particularly when it comes to the follow through. So also recognizing and taking responsibility of your role sometimes in the other person's behavior, and that comes in with blurred boundaries a lot of the time.
1000%. Thank you. All right. So here we've got the martyr in the top left-hand corner. So this one here with the lions. I don't know if you can see that on the screen. The self-sacrificing there, putting myself before always taking on all the responsibility, as well as the savior over here, taking on all the load and doing all the work, and eventually leading on to burnout, and increased stress and healthy. Then over here, we've got the advisor in the top left-hand corner. The advisor always having all the answers, always putting forward their views, their values, their opinions. Their words are the only words that one should go by. Okay. And then in the bottom right, we've got the people pleaser, which I think Luto just mentioned now, where you're trying to make everyone happy at your own expense, overextending yourself, being overworked. And then here we've got the yes person. Beautiful illustration, with the mask, and behind the mask just simply falling apart. So even as the codependent person, you are the one wearing the mask in this situation where you're taking on so much. You're saying yes, you're saying enabling, you're giving all of you, and who's that sound? Very distracted. Hold on. Luto, do you mind just muting that for me? Thanks. All right, but then in actuality, you're struggling behind the mask. And then over here, this is also just really nice. Two mountains on separate sides, chained together. And that is what codependency is that there's no individuality, there's no sense of self anymore. Okay. Then, yeah. This is just a summary of everything that we've discussed. We went through personal boundaries, what they are, in essence, the importance of the self-esteem and sense of identity. We looked at the common traits within rigid boundaries, porous as well as healthy boundaries. Then we had a look at the 6 different categories and how they identified, when and where to use the boundaries. The most important part for me was the setting of boundaries. We identify, we establish consequence, we communicate, and obviously the follow through. And then had a quick look at codependency and touched a bit on how it affects the sense of self and the identity that was mentioned at the beginning. Anything from you before we close up shop, Luto? Before we open up for questions?
No, I think we've highlighted all the significant aspects. I think perhaps someone might have a question that we might answer.
Wonderful. We're opening the floor to questions. You're also welcome to type out your question in the chat room as well. Ah, thank you. It was my pleasure. How do we set boundaries? Kim, can I ask you to be a little bit more specific? I'll go back to the setting boundaries slide. Is there something that you're struggling with?
While we're waiting for Kim to respond.
Yes.
Oh, okay, there we go.
Okay. So I'm not sure if maybe this will help. So the idea of the consequences is based off of what your limitations are and what you are comfortable with putting in place should your identified boundary be violated. I don't know if maybe Luto, do you have another example that we can maybe use?
Like we face this on a daily basis, right?
Yes.
And I think, isn't this one of the biggest struggles families have with having an addicted loved one? It's one of the main reasons why it's hard to set a boundary, because they're scared of their follow through. They're scared that consequence actually looks like. And we're dealing with somebody who's manipulated us for such a long period of time. So, a lot of families say to us daily, I couldn't set the boundary because I was scared he was going to die. I didn't set the boundary because I thought he was going to run away. Didn't set the boundary because he promised me he would cut his wrists, or he would never talk to me again. We've had parents say to us, he promised me he'd never talk to me again. What must I do? And I laugh because I'm old and experienced, and I go, well, what are you going to lose if he doesn't talk to you again? Does it really matter? And sometimes we have to look and go, yeah, does it really matter? So it's that enmeshment of the lack of boundaries that I think makes it hard to set those new boundaries. But I think we need to just keep driving home what you both have said tonight. If they don't have boundaries, they're not going to get better. They need those boundaries as part of a prescriptive program for their recovery. So as hard as it is, Kim, and the rest of the platform, do what Lolly said. What is manageable for you? What can you live with? What's within your limitations? And what I like to suggest is do things slowly. You don't have to go with kicking them out, having them arrested, taking away their children, because you're not going to be ready to do that. But maybe the first boundary is when they phone you in rehab and they say, the food is terrible here and I really hate Cheryl. You go, I'm sorry, I don't really care. That's the rehab you're in. I'll speak to you next week, Wednesday. Have a good week. Love you dearly, not fetching you. I'm taking time to educate myself, get some support for myself because you've driven me mad. That's a very powerful boundary that you don't even think that it's important. So, ask your counselors if your loved ones are in treatment with us. Ask your counselors for guidance, because we'll happily tell you what we recommend. But join as many support groups as you can, because boundaries, as Lolly clearly said earlier, it's a long process. It's not going to happen. You're not going to wake up one day with a set of boundaries inside your head going, I can achieve these. So the consequences are what puts us all off, but the consequences are it's a necessity for an addict to recover. So Kim, I hope we answered.
Sometimes within the families, there can be a disagreement or contradictions about boundaries. Any recommendations? That's a good one. That is a good one. I think if whomever the different family members are, it's about again being open and honest about where you stand. What is your point of view? And also be willing to find a middle ground, because that is also a part of just general growth, general assertiveness, not just in terms of healthy boundaries, is be willing to be open-minded and accommodating. So I'd say the first thing is, whatever the disagreement is, Why is there disagreement? Is it because of different upbringings? Is that where the differences are coming from? Is it from different experiences? Is it different parenting styles? How can we meet each other in the middle? But still making sure you are verbalizing your side to the best of your ability. Because again, we can't control people, places, and things. We can only control our own reactions and our own actions. So at least if you put that forward and listened to where the other person is coming from, using a beautiful technique, active listening as well as reflective listening, and being able to clarify where their perspective is, you'll be better equipped to verbalize your side of things and then find a middle ground. So it's just about having a discussion.
And an honest discussion.
Yes,
Lolly.
yes.
And I want to be a bit facetious, Merle, if I may. It's not sometimes, it's most of the time. A part of the disease of addiction, the way one of these symptoms manifest is that the addiction and the addict causes these disagreements in the family. It's important for the addict to push everybody apart so that they can go through and carry on using in peace. So that's common for us to disagree, but finding that common place, as Lolly was saying, and being honest. And I think that's where we as family members, and often the codependents, we take years to tell people what we really feel, because we're still being nice, we're still trying to accommodate, we're still trying to rescue and fix up and pick up the pieces. So the quicker we can present that united front, transparently, honestly, directly, saying, I can't cope with this. This is not working for me. Your style is your style, but my style is different. Let's go and get some help. Let's find out how to get on that common ground together, because our child's life actually depends upon it. I'm always fascinated when everybody goes quiet when we talk about boundaries.
Yeah. What's scheming there? See another message. You're very welcome.
I think it's very painful when your loved one joins rehab, goes into treatment for however many times, and we start looking at ourselves and we start looking at the mistakes we've made. And I don't like to say we have gone wrong, but I like to look at the mistakes that I've made. And when you start recognizing that your boundaries were either toxic, inflexible, rigid, dangerous, there's a lot of guilt and shame. And you did touch on it, or Luther mentioned it earlier. Sit with it, feel it, it's okay. Like we have that guilt and shame. I don't believe we caused it. I don't believe we can cure it. We definitely can't control it. But we've contributed to it because we didn't know any differently. By attending these groups and going for your own therapy, going to Tough Love and Al-Anon and Nar-Anon meetings, we can't claim ignorance anymore. So if you set one small boundary a day, that's a huge growth.
Yeah, I agree with you, Cheryl. That, like I like to say, life's gonna life. So if you make a mistake, it's fine. You're human. We make mistakes. Just kind of go on with it. Okay, I've often found myself shifting boundaries for my loved ones, sometimes to the extent of affecting other members of the family. Okay,
that's exactly what you were just saying.
Yeah.
It's very honest to acknowledge that and to see it and to raise it. So well done. I think every single one of us on this platform, if we were honest, should be putting up our hands, because we do. Because setting boundaries is scary. If you haven't grown up with boundaries, I like to say most of us as South Africans, we grew up with a lot of rules, but our boundaries were questionable. because our parents didn't know differently, and our cultures and our society didn't maybe necessarily know differently. So it was always do's and don'ts.
Mm-hmm.
But the internal boundaries of all the stuff that we've processed tonight, of claiming your space, this is where I start, this is where you end. We learn that in adult life because our parents may just not have been able to teach us. Our school systems may not have been able to teach us. Our families may not have been able to teach us. So if we make those mistakes, that's okay. Keep fighting on. You know, if your child relapses, you're not going to go and chop him up and put him in the dustbin. You're going to phone us and say he's got to go back to treatment, he's got to go to meetings, or we've got to do something. So if the families relapse and break a boundary and shift a boundary, then they need to get back on the horse, set another one, make sure it's manageable, and carry on. I think, you know, truth be told, I've been living with addiction for more than 30 years, and maybe only after 12 years did I really know how to send healthy, non-negotiable boundaries with them that weren't hurtful to them or to me. Because for 12 years, we just fumbled our way through it.
And there's that time component again.
Yeah, time takes time. Addiction took a long time to manifest. It's going to take a long time to recover and treat.